If you've really got to pee, like all the time, what's going on and what can you do about it? We'll discuss this on today's episode of Taking the Floor.
Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being. We're your hosts, Kandis
and Bijal Toprani,
and we're both pelvic health physical therapists here at Hinge Health. Thanks for being here. Now, this episode is a part 2 of a two-parter. If you haven't listened to part 1, which is all about our member Uzma's experience with urge incontinence and how she was able to find relief, we definitely recommend you go back and do that, either now or after you finish this one. It's a really powerful story and just drives home how big a deal these issues can be and how dramatically things can change when you find the right care.
But if you're ready to get into the weeds on urge incontinence, you are in the right place. Let's explore the PT perspective on this issue. In particular, why it happens and what you can do about it.
It's important to understand what's causing symptoms of urinary urgency. So pardon my nerd out that's about to happen here, because some of the things that you are potentially trying to do to manage your issue might actually make them feel worse in the long run. And I don't want you to feel bad about that because, some of these things are very counterintuitive, even to us as PTs sometimes. So first, let's look at how the bladder works when everything is going well and why urinary urgency and frequency can happen. So I want to introduce you guys to my concept here of the pee symphony. Bear with me. I promise it will make sense by the end. Your bladder is a stretch organ that expands as it fills, and it sends a go signal to your brain. So once it sort of fills up to a certain degree, it'll kind of trigger this go signal to your brain. So that signal travels up your spinal cord and it tells your brain, hey, I have to go to the restroom. And then your brain sort of looks around and it's kind of assesses the situation, right? It sort of says, is this the time for us to go to the bathroom right now? Or is this maybe not the best time? We're on the freeway, there's no bathroom. And that signal comes back down to your bladder to sort of contextualize things. And so, as you can see, your brain really acts like that symphony conductor. It's really sending the signals back down to your bladder and your pelvic floor muscles to sort of tell them what to do next. And so your brain, if it's a great situation, you're near a restroom, you really got to go, your brain is going to send that signal to contract your bladder. Your pelvic floor muscles are going to relax. And you're going to release the urine once you make it to the restroom and everything is good to go. And so you can see it's really a quite elegant system that works great most of the time. But I imagine if you're here, maybe sometimes that's not working so great for you. So there are things that can kind of throw off this harmony. And mainly it's when we confuse our symphony conductor, right? Remember our brain. And so here's what I mean by that. If you make it a habit to go before your brain gets that full gotta go signal, the conductor can get really confused. And this is what we're talking about when we talk about this concept of just in case peeing, like right before you need to go somewhere, or even if you don't really need to go at that moment. Your brain starts sending stronger signals now because it thinks it's sort of like missed the signal, right? So it starts to send stronger signals to your bladder and that urgency starts to go up because it feels like it missed the message. And then pretty soon, if you do this time over and over again, your brain is now telling you that it has to go all the time.
Yeah. And I think that when you mentioned the pee symphony, your bladder your brain shouldn't really be getting that, hey, it's time to go sensation or that signal unless your bladder is what we would consider full. And so that would be like you're actually having to pee for 10 to 12 to 15 seconds. If you notice you're peeing just for a couple of seconds, then that's a sign to you that you might have gone earlier than you really needed to go. And another culprit is hypertonic or tight pelvic floor muscles. So you need to be able to relax your pelvic floor muscles to take the pressure off of the urethra and empty your full bladder. So if your pelvic floor muscles are too tight, you might not empty your bladder fully, causing you to feel the urge to empty again sooner. If your urine stream is slow and you're jealous of that whooshing sound that's in the stall next to you, tight pelvic floor muscles could actually be the problem or be that culprit. And if you suspect that this is an issue for you, then you can talk to your physical therapist about ways to relax your pelvic floor muscles. This is also why exercises can be really helpful for this condition, because they can help you learn to relax and to really release your pelvic floor.
I also wanted to bring up that some medications and conditions can contribute to bladder symptoms as well. So medications like high blood pressure and heart medications, muscle relaxants, things like antihistamines, sedatives, antidepressants, all of those can actually affect your urine output and how your bladder itself contracts. And that can cause some of those symptoms of urinary urgency. And then another really big one to rule out is a bladder infection or a UTI. And this is usually accompanied by some other types of symptoms, things like pain, stinging with urination, and in some cases, even fever. So if you're suspecting that you're having a bladder infection or urinary tract infection, you definitely want to make sure to see your doctor to get that ruled out.
All right, so now that we've talked about some of the culprits and some of the ways that we might be causing urge incontinence, let's talk about what we can do about treating it. So as many factors as there are that really contribute to these, there are also a ton of ways to help reduce it, including managing stress and avoiding overdoing it on foods and drinks that can actually irritate your bladder. Those are things like caffeine and spicy foods. We could do a whole episode on just those bladder irritants, and maybe we will in the future. But today, let's focus on some of the more surprising ways to manage and prevent urgency and frequency. So, Candace mentioned it earlier. It's that just in case peeing, right? So we call that jicking in the pelvic PT world. So one of the ways to really help this symptom of urge incontinence is going to the restroom or peeing when you actually need to and not just in case. So some of the reasons why people do that just in case pee is because, there's a lot of anxiety around maybe not being able to make it to the bathroom on time if you are going to be away from the restroom for a while. But we talked about this earlier. It really messes with that pee symphony and that kind of harmonious relationship between your bladder and your brain. So I always tell my patients that they should work on only going to the bathroom when they need to and avoiding that just in case pee when they're at home or they're in a safe space where not doing that just in case pee isn't going to add to their sense of worry or their sense of anxiety. But when you're first working on this, you may still choose to go to the bathroom just in case before bed or before a really long commute, and that's okay. You really want to give yourself grace when first starting out.
Bijal, as you were saying that, I was just actually thinking about how as a parent, I actually have to check myself on this a lot with my little ones. Like, I actually found myself doing this the other day where I was like, oh, we have a long ride and like maybe I should have my daughter go to the bathroom before we get in the car. But I had to really check myself and be like, no, that's not actually the best thing. She doesn't have to go. But at the same sense, like that point you were just making about like, don't add to this like sense of worry. Sometimes I do make that conscious decision where I'm like, you know what? We all just need you to use the restroom like right now. And we'll continue working on this tomorrow.
Totally. Yeah. There's like this practicality aspect. There's a lot of different things going on when you're making this decision. So that makes a lot of sense. And I think as a parent, and you mentioned that, Our parents, when we were growing up, they would tell us, go to the bathroom just in case before you get in the car. Like, this is a normal thing that we've learned. So there's a little bit of like untraining that needs to go on with this whole like just in case rule. So the second bladder habit is that you really want to let your urine flow naturally instead of the power push. So when you are sitting to empty your bladder, we talked about this earlier, but Kandis mentioned that your bladder is going to contract and your pelvic floor muscles are going to relax. So they have this opposite relationship, and that's the normal way that your body is going to have to act to have a urine stream that's natural. So when you do a power push, which is actually trying to push the urine out, you're actually contracting your pelvic floor muscles instead of relaxing them. And that kind of messes with that natural pee symphony that we just described. So you really want to just allow the urine to flow naturally out of your body. One of the functions of the pelvic floor is actually supporting your organs like your bladder and your uterus. So when you power push, you're actually putting a lot of pressure on the pelvic floor. And that's not really ideal for those muscles. They can get weak over time when you're really putting that pressure on it. And it can cause them to be less effective at providing some of that support for those organs, like that bladder and the uterus. And it can lead to something that's called a pelvic organ prolapse. Now, I've probably scared you guys, and I'm sorry. I don't want to be, that's not my intention. Please don't be scared, because there is something you can do instead of the power push. And that is simply breathing in and out normally while your bladder is emptying and allowing that beautiful automatic inverse relationship between your pelvic floor and your bladder to just do its thing. And big belly breaths that are really calming while you're on the toilet is one of the healthiest bladder habits that you can have. One of the reasons you might choose to power push is that after you're done peeing or after the urine stream has stopped, you still feel a sensation of having to go, or you feel like you haven't fully emptied your bladder. So instead of power pushing, some other options that you can use are standing up from the toilet and just kind of resetting. So you can stand up for a moment and then sit back down and then try to have that kind of relaxed pelvic floor musculature, taking some deep breaths and seeing if there is some urine that still comes out after that. Another option, again, is to, instead of pushing that urine out, is kind of just shifting your hips side to side or forward and back to get a little bit of movement of your pelvis, and then seeing if a little bit more urine is still left and needs to come out. If none comes out at that point, then you're probably safe to just go ahead and get back up and try to see if that urgency sensation kind of subsides over time. But we still wouldn't recommend trying that power push as another way of making sure that your bladder is empty, just because of the impact that that can have on your pelvic floor over time.
I love the way that you just said that. I am feeling so calm right now. But to shift gears to another habit that may feel not so calm, let's talk about the anxiety some of us feel when we have to use a not so clean looking toilet out there in the public world. Feeling nervous about germs or just general ickiness can lead some of us to do what we call the hover pee, where you don't really sit down fully. While this isn't really a big deal once in a while for a truly gross toilet, it's really not a great habit to do repeatedly. And that's because peeing from this mini squat position actually makes it harder for your pelvic floor muscles to relax and can lead to incomplete emptying of the bladder and even tension in your pelvic floor. This can then make your urinary urgency feel worse down the road. So please, try to sit down and relax to pee whenever possible. You're very unlikely to pick up some kind of infection. Just make sure to wash your hands. And then sometimes one of the more controversial kind of tips that we give people is to actually drink more water. And like the eyes on people when you make this suggestion to them and they're like, I'm already peeing so much and now you want me to drink more water. And what we often find is that they're limiting the amount of water that they drink purposefully because they don't want to have to pee so often throughout the day. But this concept is actually kind of counterintuitive because when you are not taking in enough water, your urine concentration tends to be a little bit more acidic, which sort of irritates the bladder and sends the bladder into some of these kind of like spasms that make you feel like you need to go to the restroom all the time. So, trust in the process. Start drinking a little bit more water. You might need to initially go to the restroom a little bit more when you start drinking more water, but that's okay. Your body will get used to it. You're resilient. You may need to do some exploration about like when you're drinking your water. If you remember Uzma's story, that made a really big difference for her, kind of like not drinking after some point in the night to get those longer stretches of sleep. So, remember to consider kind of the when as well.
Okay, so what do you do in the moment when you've really got to go, but you know that it's probably not time? You just went recently, or you know your bladder isn't full. Your best move is to start gently retraining your brain bladder connection so you can turn down the volume on these signals, reduce the urge, and over time expand the amount of time between bathroom trips. We get that this is a lot easier said than done because if you really, really have to go, you really have to pee, it's hard not to. But let's talk through some techniques that can help. We're going to go over what to do in the moment and retraining over time.
Okay, so first, let's talk about that gotta go moment. One of the things that we highly recommend is sort of trying to tune into your body and rate that urge on a scale of 1 to 3. 1 being, I sort of need to go, and 3 being, all right, I really, really, really need to go. Get me to the bathroom now. If it's a 1 or a 2, we want to offer to maybe try a few of these things. So the first one might be to kind of get up, change your position, stand up, sit down, cross your legs, push your knees together. All of these things can sort of just reorient and reset that symphony conductor, that P symphony we talked about earlier, and kind of give you a sense of really, okay, do I need to go now, or was that just a sensation that my body was making me feel like I had? Another one, tried and true, that works for a lot of people is to actually do 5 quick Kegel contractions or hold a Kegel or pelvic floor muscle contraction for 5 seconds. What this does is it sort of like sends a signal back up to the brain from the pelvic floor muscles that just says, hey, I get it, but it's, I'm not sure if this is the time to go right now. So that contraction, really tells the bladder to quiet down and also tells the brain, like, maybe this isn't the right moment. Of course, breathing, we will always tout that as a good strategy. That just helps relax our nervous system. And sometimes, like you heard in Uzma's story and you've heard us talk about a few times, is that anxiety of it all sort of like heightens that sensation of having to go. And so really taking big breaths through the belly, feeling the pelvic floor muscle relax, can actually help us reduce the urgency.
You can also try to distract yourself. A good old school way to just kind of get your mind off of anything. It works for this urgency feeling too. So you can distract yourself with a task and kind of work on finishing that task before you revisit whether you need to go. And you might find that after you're done with that task that you actually didn't need to and that urgency had really subsided. You can also perform 5 heel raises. So It's kind of wild, but there's actually a big connection between your ankle joint and the pelvic floor. And so when you perform a contraction of those calf muscles and perform a heel raise, it actually helps contract the pelvic floor as well. So you can do that in a standing position. Just go ahead and stand up, perform 5 heel raises, and kind of push those toes into the ground. And you might notice that that urgency kind of subsides. And then you can also try and walk slowly and calmly to the bathroom when the time comes to empty. So I kind of alluded to this earlier, but I talked about that 2-year-old and kind of retraining the bladder is kind of retraining or training a toddler to act a certain way. And so that's why you really want to be the boss of your bladder. You don't want to just give in to its urges and sprint to the restroom. You want to take that control back and say, no, I'm going to walk slowly. I'm going to walk calmly. My bladder and my brain are going to wait for me to be ready to go ahead and empty. And that can really have some profound impacts on kind of retraining that bladder and that symphony over time.
Yes, the brain is boss. That's such a good thing to remember. And so just reorienting, like that's if you have that 1 to 2 urge. These are some things to try to really reevaluate if it is the correct time to go to the restroom. So if we go back to our scale, if it's a 3, which you'll remember is that like, I got to go right now, find the bathroom. What you should do is go to the restroom, sit down, no hovering, remember, and you're going to count the seconds it takes you to pee. 10 to 12 seconds means that your bladder was, appropriately full. It needed to be emptied at that moment. And great, you're on your way. If it was less than 10 seconds, the next time that you feel that same level of urge, you should treat it like it was a 1 or a 2 on that 1 to 3 scale and try at least one of the tips that we just went over before you go.
Yeah, and I like to add that maybe this is silly, but like the seconds counting, a real second, like 1 Mississippi, 2 Mississippi, 3 Mississippi. If we're going 1, 2, 3, 4, 5, 6, you might still be going a little too early. So really treat those seconds as real seconds. Okay, so that's what to do in the moment. Now, what about retraining your bladder over time? The key is to set realistic goals to just slightly extend the amount of time between bathroom visits. So let's say you usually go once every hour. Maybe you can set a goal of increasing that interval to an hour and 15 minutes. Over the course of a few days, you use those same tips that we just went over, the Kegels, the breathing, the heel raises, to gradually extend until you get there. Then you add another 15 minutes and so on. Make those slight increases each week until you reach an interval of 2 to 4 hours between most bathroom visits.
And of course, we would be remiss as physical therapists if we did not also share that movement, breath work, exercise therapy are really important in reducing symptoms of urinary urgency. So, if you have urgent incontinence and you're in our programming, you might see exercises like abdominal bracing, Kegels, reverse Kegels that you're working on. And that's really important because they help to just restore the balance between the muscles of the abdomen and pelvic floor. They help us become more aware of our pelvic floor muscles. So learning to contract them and relax them is really important if you have urinary incontinence, especially if you have that urge. You've heard us kind of talk about this critical component of sort of being able to relax during urination. And so being able to tap into your breath and your pelvic floor and be able to do those is very important.
All right, let's go over the 3 most important things to remember from this episode. First, bladder urgency with or without leakage is a big deal and can have a major impact on your quality of life. It can be a sign of a problem with your pelvic floor or an issue with how your brain and your bladder are communicating with each other, which is that P symphony.
Next, there's a lot of different causes of urinary urgency and frequency. And so after you rule out UTIs, medications, or other causes, you want to look at the behaviors that you have in your daily life, especially around the bathroom, that could be contributing, along with tight pelvic floor muscles and any other things that you could be doing in your daily routine.
And third, this is the biggie, is what to do about it. So improving your bladder habits is key, as well as practicing urge suppression and trying bladder retraining. And of course, doing your exercise therapy teaches those muscles to relax so they can allow that pee symphony to perform the way it's meant to. All of these things can make a big difference in how often and how urgently you're dashing to the bathroom. And we really feel that pelvic floor care and pelvic floor exercise therapy really is a need to have. It's not something that you just do out of kind of like a self-care place, but it's really something that you should prioritize and is a non-negotiable. So speaking of non-negotiables, it's a really important thing for us to kind of check in with each other and make sure that we're holding each other accountable on making sure we're doing our non-negotiables. So Kandis, what are you working on right now?
I have a lot I'm working on, but the one I think I want to really prioritize this week is eating meals on my own plate and kind of in my own space. And so with two little teeny ones, it's not uncommon for my breakfast or lunch to sort of just look like a bite of their leftovers or something at the counter while I'm, doing dishes and 3 other house tasks. So I want to, for one meal a day, I want to sit down with the food on my plate that was meant for me and eat it. What are you doing, Bijal?
Yeah, you definitely deserve that. I like this for you. Your own plate, your own meal. My non-negotiable is that today I have a goal of doing this little 28-minute exercise. And so I am committing to that particular exercise that will only take me 28 minutes. And it actually breaks down into like 4 7-minute sessions. So it's my non-negotiable that I can give myself 28 minutes of exercise to get my heart pumping and feel a little bit better.
I believe in you. You can do it. I'll be excited to hear how it goes. And thank you all so much for listening. If you'd like to work on bladder urgency further, one great tool is to explore the urge suppression meditation in the guided breathing section of your app. Remember, if you're dealing with pelvic floor issues, you are not alone, and we're here for you.
The information contained in this podcast is intended to be used for educational purposes only and does not constitute medical advice or treatment for any specific condition. Please consult with your healthcare provider with any questions you may have about your medical condition or treatment. Check out our Hinge Health app library for new episodes coming soon.